Hello, I'm Dr. Frank Spinelli, and today I will be presenting a comparison of the factors associated with depression among older Black women and men living with HIV. My disclosure is that I work for ViiV Healthcare. The population of older adults living with HIV is growing. Within this group, Black people continue to face a heavy HIV burden, and depression is prevalent. 49% of Black people living with HIV have an indication for antidepressant treatment. 20% of older Black people living with HIV in ad hoc experienced depression. 21% were women and 18% were men. Yet little data exists on factors associated with depression among Black older adults living with HIV and whether these factors differ women versus men. The goal of this analysis was to use data from an online registry called Aging with Dignity, Health, Optimism, and Community to describe these differences. The methods employed use the Aging with Dignity, Health, Optimism, and Community study is a prospective observational longitudinal cohort launched in 2017. Data, which was all self-reported, were collected between November 2017 through May 2019. All the participants who indicated they were Black, which was a population of 209, were included in this present study. Depression was measured with the two-item patient health questionnaire, which ranges from 0 to 6, and a score of 3 or higher indicates a positive screening for depression. Separately, for women and men, cross-sectional bivariable analyses were conducted between depression and a variety of sociodemographic, health status, and clinical indicators. Separately, for women and men, factors associated with depression in those bivariable analyses were included in linear regression models, which were reduced through the backward selection. So the methods employed 4 different areas: sociodemographic, which included age, sexual orientation, relationship status, income, education, and employment status. The second was behavioral: recreational drug use, tobacco use, alcohol use, feeling close to friends, and living alone. The third was psychosocial, which included anxiety, quality of life, loneliness, social well-being, stigma, and loss of previous partner due to HIV. And then finally, clinical indicators: antiretroviral adherence, undetectable viral load, number of years since HIV diagnosis, and number of comorbid conditions. The results were showing the following. As you can see, the mean age in both groups was about 60 years old. Compared to men, a higher proportion of women were heterosexual and had an income of an annual rate of $50,000 US a year, and most did not have a 4-year college degree. When we look at the logistic regression of factors positively and negatively associated with depression among Black women, we see that the link was with anxiety, antiretroviral adherence, 20 years since their HIV diagnosis, and resilience. And then looking at the logistic regression positively and negatively associated with depression among Black men with HIV, we found again anxiety and antiretroviral adherence, but the difference here is living alone and reporting loneliness. So in summary of the factors associated with depression among older Black women and men with HIV, we found that among both men and women, we saw higher anxiety rates, and poor antiretroviral adherence significantly increased the odds of screening for depression. And among women, but not for men, low resilience and having been diagnosed less than 20 years with HIV increased the odds of screening positive for depression. And then among men, not women, living alone and feeling lonely significantly increased the odds of screening for depression. So in conclusion, this study compared the factors associated with depression among older Black women and men living with HIV. Depression interventions among older Black people living with HIV should address anxiety and antiretroviral adherence. For women, interventions may be more effective if they foster resilience. And for men, interventions may be more effective if they include techniques to combat loneliness. and overall tailoring interventions to the specific needs of older Black women and men living with HIV should help combat depression more effectively in these important populations. I would like to thank all the study participants, and if you have any questions, you can please contact me at that email address on the screen, or Jeff Burko at his email address as well. And I would like to thank you for your attention.